Dadah. Apa? Kayak siapa? Oh, kalau ganti kayak Om Surabaya ya.
Masya Allah, cantik banget ya. materi ini di Instagram sedang ramai digoyang-goyang. Caranya seorang influencer. Assalamualaikum ya. Materi ini di Instagram sedang ramai digoyang-goyang.
Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Good morning, ladies and gentlemen. Welcome back to Public Health Airlangga University Summer School 2021. Understanding Human Body Composition and its Assessment Technique. Hello everyone, finally today we meet again, and it's me, Wulan. I'm a student from Department of Nutrition, Faculty of Public Health, Airlangga University, as your Master of Ceremony for today. And it's a pleasure to see you again in this morning. Okay, today is the third day or last day of our summer school, and we have a special topic about application of anthropometry in health and sports sciences. And again, in the last day, now we have already had Professor Masa, Deputy Director of the Institute of Human Nutrition Science, Kagawa University, Japan, and our beautiful moderator, Miss Emi Raisa Isaura, SGZ, MPH, PhD. She is a lecturer from Department of Nutrition, Faculty of Public Health, Airlangga University. All right, we have already had Professor Masa and Dr. Emir. Good morning, Professor Masa and Dr. Emir.
Good morning. How are you? Good morning, Prof. Masa.
Good morning.
Okay, I'm really good. Okay, I have a question for Professor Masa. How do you feel about our summer school so far, Professor?
Yes, I'm quite surprised that quite many people are questioned about the topics every day. So I am very grateful that everyone find interest on my topic.
Okay, all right, that's great. Thank you so much. Okay, ladies and gentlemen, without any overdue, I will give today's summer course to our moderator. To Dr. Emir, the screen is yours.
All right, thank you, Ms. Fatiatul Wulandari. Okay, right. Good morning, everyone. Okay, I hope everyone still be happy, healthy, and still keep it excited with the topics. Okay, the last topic in our summer course is application of anthropometry in health and sports science. Okay, probably anyone have some experience in the maybe health science or sports science. You can come up with the question because this is the last summer course, so you don't want to miss the chance to ask from the our guest, I mean like our professor that will deliver the presentation today. Okay, I hope everyone is ready. All right, I will give the screen and time for Professor Masa. Professor Masa, this is for you.
Thank you. Good morning, everyone, and I hope you are enjoying my past 2 days lectures. Today is my last lecture. It's a pity, but I hope you enjoy the last topic as well. So let me share my slides. Okay, hope everyone can see my slides okay. Yes, okay. All right, so let's get started. Today's topic is an application of anthropometry in health and sports sciences. So as previous 2 days lectures, this slide gives you points to learn from this lecture. First, I want everyone to understand major purposes of using anthropometry in health and sports sciences. And the second is to learn common anthropometric indices that have been used in these disciplines. And also, this is kind of my own opinion, but to acknowledge future considerations and potentials with anthropometry in applying in health and sports sciences. But this last point is very flexible and also could be very diverse depending on everyone's interest and also everyone's backgrounds. So the ones I will give today's talk is just an example. And if you can think it more flexibly. Okay, so I just like to start off with applications in health sciences. Then later, I like to talk about in sports sciences separately. So this is one of the today's top point, purposes to use anthropometry in health and sports sciences. The main purpose is to first is monitor growth and development in infants and children, and also important to screen individuals at risks. And this is actually overlaps with yesterday's topic, but the anthropometry can utilize to identify the target before conducting treatment or intervention. So if you try to treat obesity or overweight, you can set a target based on BMI or waist circumference. So unlike, although anthropometry is not for main purpose to estimate body composition, it is still sufficient to utilize anthropometric indices to set a target. And of course, once we set target, anthropometry can utilize to evaluate how effective the treatment or intervention was. And of course, this is again kind of overlap with yesterday's topic, but anthropometry can be used to assess body image related research. And first of all, I'd like to mention the standpoint of WHO with regards to application of anthropometry. This is a publication in 1995, but in this document, the technical report published in 1995 clearly stated that anthropometry is the single most universally applicable, inexpensive, and non-invasive method available to assess the size, proportions, and compositions of the human body. And this document encourages us to utilize anthropometry more often. However, at the time of this publication, there hasn't been sufficient application of anthropometry, and therefore WHO recommended all member states to utilize this anthropometry technique. And because this anthropometry is so simple and can be utilized at any location, this anthropometric measurements and results from the dataset can be utilized for creating or establishing public health policy, and also to propose simple screening cutoff points at the on the field. So first of all, this is the list of indices which we can utilize anthropometry to assess growth and development. For infants, most important variable would be birth weight and also later body mass, and also lengths and circumferences at different sites, such as head, trunk, and thigh, can be utilized to monitor their growth. And sometimes we do use ratios of these circumferences, like trunk to head ratio or thigh to head ratio, but these can be equally useful. And once child has grown to become a certain age, to adolescents, to young adults, stature or body mass, circumferences, and also proportionality, such as BMI or ponderal index, can be utilized or commonly have been utilized today. I'd like to start off with birth weight as a very simple but important variable for monitoring growth. WHO defines the level of adequate growth based on birth weight, and any infants born below 2.5 kilograms, we classify infants as low birth weight. And if infants born below 1.5 kilograms or 1,500 grams, we consider this infant to be very low birth weight. And further, if this infant had the birth weight below 1,000 grams or 1 kilogram, we define or classify this baby to be extremely low birth weight. Obviously, these infants born with very low birth weight or low birth weight had a much higher mortality risk compared to infants born above 2.5 kilograms. And so therefore, this birth weight has been one of the very essential screening variable for adequate growth in uterus. Then, unfortunately, Japan is one of the countries where the rate of low birth weight infant birth is high. And I have seen a number of, I had an occasion to see infants who had the birth weights below 1,000 grams, and it is very, feel very sorry to those very small infants, small babies. But at the same time, infants who were born with very huge, very big, is also problematic. And infants who had birth weight equal or greater than 4,000 grams or 4 kilograms, we define this baby to be macrosomia. And this condition also increases risks of shoulder dystocia and injuries on brachial plexuses at birth, because baby was grown too much and having difficulty getting born or getting birth. And if baby had much heavier weight, like more than 4.5 kilograms, then actually a mortality rate of infant actually increase. And if a baby survived during infancy, still those babies born macrosomia had higher risks to develop cancer or diabetes in later life. And infants who are born small, born with underweight, they actually have higher risks to develop childhood obesity or adulthood obesity later in their life as well. And this is partially due to the factor of epigenetics, but also there is possible reasons, including providing too much proteins or too much nutrients at early stage of their life. Once they were born underweight, their parents or their grandparents were worried too much, and they decided not to. They decided to cease their breastfeeding or bottled milk too early, and they decided to give weaning food, or they give too much food that has high or rich in protein, which actually accelerates adipogenetic activity that increases the increase in adipocytes at early stage of their life, which increases potential to store more lipid droplets compared to infants who are born 2.5 kilograms and above. And this diagram on the right shows any infants who had a very high rate of growth during the first 2 years of their life have higher chance of becoming overweight at 5 to 6 years of age. So being born in low birth, a very small weight, have a risk of getting overweight or obese in later, not too late, but during childhood onwards. And this increases risk for them to become chronic health problems in later life. So this is one of the concerns that the many countries actually face at the moment. And another the variable that I can introduce today is head circumference. And well, it's very unfortunate, but the development of human body is very complex, and it is very easy to form deformities at birth. And this is some of the deformities of the head, this including microcephaly, which has a small head circumference, or macrocephaly, which is actually have a big head circumference, or anencephaly or hydrocephalus, as well as the differences in the head length or breadth. This development of skull is actually have been reported to be associated with development of brain. And this is very classic study, but this Winnick and Rosso actually collected data from infants who actually are born, or infants who actually not successful in the delivery, and did the cadaver analysis on those infants, and they find out that the content of brain protein and brain size or brain mass is some associations with head circumferences. Therefore, application of head circumference can be considered to useful index or useful variable to assess brain development. And for this purpose, there is some definitions for macrocephaly or microcephaly using head circumference. But unfortunately, there is some different definitions or cutoff points exist to define macrocephaly and microcephaly. In clinical setting or clinical setting, we can define infants with microcephaly or macrocephaly by having 2 or plus minus 2 standard deviation of the same population. But with regards to this morphology perspectives, we utilize plus minus 3 standard deviations. And also, there is a way to define the megalencephaly, which is the abnormally large brain, by utilizing head circumference, or in this publication they call occipital frontal or circumference. But again, this is not very specific, and if the value is between 2 and 3 standard deviations above the mean, can be considered as mild or borderline megalencephaly. And with regards to the shape of a skull or the head, we can utilize the ratio between the length and the breadth. Actually, the diameter, I would say. Then for this deformities can be considered as dolichocephalic or mesocephalic or brachycephalic. To define whether this infant have any of these unusual sort of skull shape, we can calculate cephalic index, which is a ratio between head breadth and head length. And this has been utilized since 1960s. So it's been quite a long time. And if there's, of course, there's some racial trend in the skull shape as well. So it may be quite an interesting topic to utilize this cephalic index. with regards to brain developments and also racial differences and cross-cultural, cross-ethnic comparisons. And I have been focusing on infants and head circumference, but now I'd like to introduce you maybe more popular health topics, which is multiple burdens of malnutrition. As everyone already know, that malnutrition is a condition of inadequate energy and nutrient intakes. So this actually covers both underweight or undernutrition and overnutrition. And nowadays, because we know that both wasted or stunted children, as well as overweight or obese children may affect in the health conditions in future and becomes impact to the country's productivity and economy. We also states the condition as multiple burdens of malnutrition. So instead of or until no, I won't say recently, but until for the while we call double burdens of malnutrition at the beginning, now we mention these problems as multiple burdens of malnutrition. To assess adequate growth among children, the easiest indices or variables that we can use is height and weight, or stature and body mass in this slide. These are very fundamental, very fundamental variable for anthropometry, and very simple indices for tissue mass. And in many countries like Japan or China and many others, the US, they have their own growth curve or growth chart to compare the growth of children of their own countries. But because many countries do not have their local growth charts, so WHO have proposed international growth reference for height, weight, triceps skin folds, or subscapular skin folds, and so forth. So which we can access from WHO website by free. And therefore we can utilize this growth chart to assess adequacy of growth, as well as any risks for wasting or stunting or overweight among childhood or among children. However, one thing we have to always be aware about growth chart is this height and weight cannot distinguish between fat tissue and fat-free tissues. So these are insufficient to examine the actual body composition-wise. Now, this data is slightly old, by getting old now. It's about 6 years ago. But compared to 1990 data, the number of children who were stunted has declined, but the number of children who are considered to be overweight is increasing. So now these two extreme conditions is still exist in the world, but now this number of children with overweight is start to increase, and it's very concerning that this number increases further, and that means increases risk group who may develop cardiovascular diseases or type 2 diabetes and many other metabolic abnormalities. And because WHO proposes this international reference, they also defines all these stunting or underweight or wasting and overweight conditions based on these growth charts. As you can imagine from the slide I showed you with head circumference, it is very common to use greater than or below 2 standard deviations as a cutoff point. And here also there is some examples showing that the stunting or underweight like 2 standard deviations and below for like stature for age or body mass for age. And in this table, just the overweight that we are looking for 2 standard deviations and above for body mass for stature. The rest is 2 standard deviations and below. So make sure you differentiate the 3 other conditions and overweight. For malnourished children, we know that the protein energy malnutrition causes the conditions called kwashiorkor or marasmus. But these conditions actually alters physical characteristics of children. So for children who are experiencing acute malnutrition with especially protein deficiency, they start to have pitting edema or distended abdomen, loss of teeth, or having thin hairs, or dermatitis. So it's looks, it's actually shown on the left-hand side of this slide, but looks plump, but this is due to edema, and this condition is not really healthy at all. But once this condition continues and experience more longer term deficiency of energy and nutrients, then children will start to getting thinner and thinner, losing more weight, and then start to deplete their muscle tissues and provide and breaks down muscle tissues into glucose and provide those glucose to essential organs such as brains and heart to make sure that this child retains his life. So because these conditions alters physical characteristics, it is possible to detect signs of these health conditions using anthropometry. And most popular anthropometric variable to assess undernutrition is mid-upper arm circumference. And mid-upper circumference can be measured using anthropometric tape, but also a number of organizations use an equipment called insertion tape with colors on it. And the example is shown on this slide. It has colors of green, yellow, and red on the tape. And when you measure a child's mid-upper arm circumference, we can instantly able to examine if the child has good condition or start to having malnutrition or very severe, because the color actually indicates the magnitude of condition. And this variable and cutoff point has been utilized since 1970s, and these cutoff points have been considered useful for children whose age ranged from 1 to 5 years of age. And this mid-upper arm circumference is also commonly used for elderly too, because elderly is also at increased risk for malnutrition, and therefore this is one of the assessment variable for elderly's nutrition status assessments, together with calf circumference. So there are a number of anthropometric variables that we can utilize to assess growth and nutritional status of children. And this is a table presented in a study by Friesen and colleagues in 2016, showing that basically any growth charts and also mid-upper arm circumference are very easy to use, and it's easy to accept, being accepted by participants, and very cheap. And among all, mid-upper arm circumference appear to have higher scores in simplicity and reliability and accuracy. So there may be some possibility to utilize mid-upper arm circumference more often compared to growth charts. In addition, this mid-upper arm circumference has been proposed as useful index to assess childhood obesity. This is based on a huge international collaborative research which 12 countries involved. This study focused on 9 to 11 years old children, and for both boys and girls. And the results suggested that for both genders, we may be able to use mid-upper arm circumference of about 25 centimeters to be a good cutoff point to indicate childhood obesity in this age group. So this is primary school age, But if we can detect any children who are at risk at this age group, we may have a possible chance to correct it, to check their health conditions, lifestyles, and try to improve their health status before they get aged and start to develop a number of metabolic dysfunctions and abnormalities. And together with circumferences, if you have a good skill on anthropometry, especially on skin fold assessment, you may able to combine circumference and skin fold to estimate arm circumference or arm or muscle tissues in limbs like arms and legs. And there are several prediction equations available, so which you may able to utilize. However, you have to be aware that these prediction equations are population specific. So this is saying as body composition prediction equations, which I discussed yesterday. But so therefore we cannot consider the estimated values to be accurate, but at least we can utilize the values as a one of the reference values, and then we can follow this participant for a long time to check if muscle tissues of arms or legs have improved or not. So this is one of the ways we may able to utilize corrected girths or corrected circumferences. And obviously, this is very popular anthropometric index. So almost I don't have to explain too much. But this is a body mass index, and it is currently utilized as an index to screen a risk of obesity. But I'd like to explain that this body mass index or BMI was originally proposed by this person called Adolf Quetelet, who is a Belgian statistician, and also the mathematician. What he proposed this Quetelet index was that he came up to the results that adults' proportionality is becoming mass divided by square of stature at the time of adulthood, and nothing else. He did not propose his index as an index for obesity, and therefore it is not really the purpose for body mass index to assess obesity at the beginning. However, the other researchers of later years, they examined associations of BMI and percentage body fat or morbidity or mortality rate. Then apparently there were some relationships So they considered BMI to be useful anthropometric index to screen mortality risks or obesity risks. However, this BMI was nowadays have been utilized for children, but originally this proportionality was for adults. And as an anthropometrist, it has been considered that BMI is not really appropriate for children and adolescents, as they are still in the middle of growth. Middle of the growth meaning their proportionality is still changing, still altering. Therefore, assessment of their health risks based on the relationship between body mass and stature may be misleading. So it has been avoided to use BMI for to assess health risks for children for a long time, but since 2000, Cole and his colleagues proposed the international cutoff point for children's based on BMI. And since then, this international cutoff point or IOTF classification for children's obesity and also thinness have been commonly utilized in many researchers who are conducting research on children. But there are still a number of arguments exist, and this including validity of the data set, which these cutoff points have been utilized or proposed, and also its appropriateness for the use in for Asian children as well. Because as you can see from this slide, their cutoff points for children is based on the assumption that these cutoff points for gender and age-specific values are equivalent to BMI of 25 and 30 for adults, which is overweight and obese for based on WHO cutoff points. However, it is not sure if these values are appropriate to be used for Asian adults from the beginning. Asians, as you can see from this slide that I have involved, this is the case of Japanese population for the bottom left, but Asians tend to have higher percentage body fat compared to Caucasians at any BMI level, BMI values. And also for children shows that the Asians tend to show greater percentage body fat compared to Caucasian children too. So that means for adults, BMI of 25 and 30 may not be appropriate to be determined overweight or obese for Asian adults. If this is the case, then application of the IOTF classification for children's cutoff points, which are based on the adult cutoff points of 25 and 30. So therefore, we need further evaluation on the appropriateness of the IOTF cutoff points for to be applied for Asian children. And WHO do understand that there are racial differences in BMI and percentage body fat. And therefore, in 2004, WHO has proposed what they call public health action points together, which is actually separate to their ordinary BMI cutoff points of 18.5, 25, 30, 35, and 40. These public health action points, including BMI values of 23, 27.5, 32.5, and 37.5, may be utilized to determine health risks of different racial population according to their health status. And then we can encourage improvement of their lifestyles and health status. So WHO did not actually restrict the use of BMI only to their ordinary classifications, but also prepared us additional cutoff points, which we can utilize to promote health status of populations regardless of races. So with regards to metabolic health problems, we can utilize a number of different indices to examine fat accumulation or fat deposition patterns. The variables may include direct variables from anthropometry, such as body mass, circumferences, sagittal diameter, which is the depth of abdominal region, and of course, skin folds. Some indices, including corrected values such as arm fat area or arm muscle areas. Some are ratios which are corrected by stature or height, such as abdominal to height ratio, BMI, body adiposity index, and so forth. Some are using ratios using circumferences, and some are more complicated, complex indices, which do require some calculators to do this. It's quite difficult to calculate in just by head, but there are some complex ratios too. So easiest one would be waist circumference. Currently, we understand that waist circumference correlates well with visceral fat area, then waist to hip ratio. Since visceral fat area gives much higher risk than subcutaneous fat mass compared to with regards to development of chronic health problems. So if the waist circumference can be added in screening process, then this may be very helpful. And of course, waist circumference only require anthropometric tape, and it is very convenient and both cost and time effective. So it is very less burden to both measurer and to patient. And many studies have already reported that waist circumference is a useful index to screen risks of visceral fat accumulation, metabolic syndrome, and cardiovascular diseases. And this table on right, this is a table by IDF, International Diabetes Federation, which proposes different cutoff points for waist circumference by their country or by ethnic groups. But major difference is that while Caucasians or Europeans have 94 centimeters and above or 80 centimeters and above for males and females respectively, Asians cutoff points is slightly lower for males, which is 90 centimeters. But for cutoff points for females is consistent with European. And for Japanese, Japanese do have a different cutoff points for their waist circumference, or what they call is abdominal circumference. And we have to understand the difference before we utilize. So it's quite confusion between Japanese and the international cutoff points for waist or abdominal circumferences. But because these indices gives the values differently, and which reflects different meanings of the body, we have to utilize it better by combining them. This table is one good example. Because BMI do not provide the differences of body composition, and BMI is basically the index for heaviness. So it's a heaviness relative to the height. But because waist circumference, on the other hand, is a good indication of visceral fat accumulation, we may combine BMI and waist circumference together and set up the different risk levels accordingly. And some anthropometric indices, such as height-corrected indices and conicity index, actually do consider this point, and some may not require to combine as this table, but it is important not to rely too much on one anthropometric index. It is important for everyone to understand what index reflects what, and if required, combine multiple anthropometric indices to better understand health condition of the person of interest. And this is another set of screening cutoff points for metabolic syndrome. There are a number of screening cutoff points available for metabolic syndrome, starting from 1999 cutoff point classification by WHO to the IDF, the International Diabetes Federation's classification. Although not all classifications use the same variables, you can see that some use body mass index, some use waist to hip ratio, and many actually use waist circumference. In addition to waist circumference, I'd like to introduce this index called waist to height ratio. This is sometimes called as waist to stature ratio, or abdominal to height ratio, or abdominal to stature ratio. So there are a number of different ways of expressing this index, but it has been examined that it is useful and it reflects some biochemical results, blood sample assay results, and also body composition of the participants. And in fact, recent study reported by Lee and Yim, they showed that the waist to height ratio is more strongly associated with metabolic risk factors such as hypertension, hyperlipidemia, or diabetes, or hypercholesterolemia, and hypertriglyceridemia. So regardless of gender. So possibly we may be able to use this waist to height ratio more frequently compared to BMI or waist circumference, because this waist to height ratio actually adjusted for the person's body size within this index. So we can simply use this waist to height ratio to determine the risk of visceral fat accumulation more precisely compared to waist circumference, which may be affected by the participant's body size. That means bigger the person, waist circumference maybe bigger too. But waist to height ratio can adjust the influence of body size. So this is probably better and more useful index compared to waist circumference. In addition, I haven't really prepared into a paper yet, but this waist to height ratio, or here I said abdominal to height ratio, actually associates with fitness level of elderly. So this population, elderly females with the greater abdominal height ratio tend to have poor fitness test results outcomes and high systolic blood pressure compared to participants with lower abdominal to height ratio. So I couldn't find similar results in males, but this may be another alternative way to utilize abdominal height ratio, since aging society in many countries, and as I said yesterday, or as I said not yesterday, day before yesterday, that the frailty and sarcopenia is going to be quite a problem, an issue in many countries. So this will be the last slide for health science perspectives, but the anthropometry can also able to utilize in relation to a number of different topics, including the aging society, which I just mentioned, and also to assess in relation to lifestyles or non-communicable diseases, and also epigenetics, not only not only head circumference or head diameters, but also to consider the impact of epigenetics to person's physique, and also to provide a better intervention program or treatment program, which is an aspect of precision nutrition. And of course, the issue with body image or cross-ethnic, cross-cultural perspectives, anthropometry is also very useful. But it's up to everyone who are listening to this lecture. If they have, if you have any other interest that may actually expand a potential of anthropometry in health sciences. And now I'd like to move on to application of anthropometry in sports sciences. For purposes of to use anthropometry in sports sciences this time, another 5 topics, or not topics, but the 5 points. The one is evaluation of physical characteristics of athletes. The other is the monitoring of sports performance and growth, and evaluation of training efficiency and performance, and identification of race weight and power to mass ratio. And the last is monitoring balance between diet and exercise, so which means energy balance. So to start off with, well, we have to just clarify that athletes, especially in elite level, they tend to have very specific physique depending on the sports they participate. I think many of you do watch the Olympic Games at the moment, that is happening in Tokyo right now. And you can recognize differences in physique between the sporting events you watch. And this is the same for females, and regardless of race, there is a particular pattern of physiques, and anthropometry is very, very useful to determine the physique for particular sports. And within that sports that you are focusing, we can also differentiate the best and rest athletes. This can be done by simply assessing height and weight for some aspect. Sometimes use more comprehensive assessments. This study by Uchida and colleagues reported that this is the high school baseball players in Japan, and for the national championship, they found that the winning teams who came up to the semifinals tend to become taller and heavier compared to the time of 1960s to early 1970s. And especially this, the difference of height has become significant between winning teams and losing teams who are defeated before semifinals. And both height and weight become significantly different between winning and losing teams. And in addition to body size, such as stature and body mass, assessments of skin folds, circumferences, and bone lengths or segment lengths are also able to provide additional information which affects the performance of particular sports. So this diagram on the top left, this is the surfing sports, which is also an event for the Olympic Games. This shows that the skin folds of surfers are associated with their ranking and also their performance, especially on vertical jump. And the right bottom table, this is shot put athletes. They show that all major lengths, segment lengths, were significantly different between high performers and low performers. And with regards to assessing anthropometry in relation to performance, we have to acknowledge that mainly performance can be done by muscle mass or fat-free mass. So it is important that even with sporting event that requires heavy weight, those extra weight need to be gained by muscle mass or skeletal muscle mass. If those excess or extra weight was gained by just a fat mass, then this may affect their performance and may deteriorate, so they may cause results in poor performance. Therefore, it is important to consider that a proportion of skeletal muscle that actually have a beneficial effect for this particular sporting event of interest. And this is the concept of power to mass ratio. And at the same time, we have to understand the most ideal body mass that can optimize performance. This is a concept of race weight. So we have to understand both concepts of power to mass ratio and race weight and combine them. That means we have to first determine the most ideal body mass as a whole and then to determine the best proportion of skeletal muscle mass for that particular race weight. And because there are a number of sporting events that have weight categories, we have to determine if we requires different power to mass ratio for different weight categories, or if we can use the same power to mass ratio for different weight categories. And also the other sporting events of similar characteristics, such as jump events, like high jump, triple jump, and so forth. For with regards to performance-wise, we have to consider not only adiposity, but also its distribution. So from anthropometry perspectives, there are several indices which we can utilize. The most easiest one would be just simple skin fold thickness, and take, if possible, 8 skin fold sites and examine where each athlete deposits their skin folds of subcutaneous fat. And the second is to add them up and obtain sum of skin folds. This may be adjusted for height, and put all participants into the same scale and compare in relative values. And the other is just take a ratio of skin folds of different places, different locations, such as extremity to trunk skin folds, or compare it with body mass, such as leanness ratio score. And sometimes, if there is no equipment to measure skin folds, or a bit uncomfortable with skill level of skin fold measurements, then we can simply use waist circumference, or waist to hip ratio, or waist to height ratio, which may be much more simple and easy. So today, or to date, we have a number of publications that reports the average skin folds values of different sporting events, which we may able to utilize as a reference values. Currently, we have collected some athletes in Japan, so we may able to publish those data at some stage. But if you can obtain all athletes of your own country first, then this will be very useful for future talent identification and talent development. If you cannot collect the database, you cannot construct database for your own country, then these publications or from different countries may be helpful. With understanding, you may need to consider differences in body size. And this is the data which I collected from national hockey team of Japan quite a long time ago. But as I mentioned in yesterday's lecture, skin folds or anthropometry's the most strongest advantage among other body composition assessment methods is we can use absolute value to understand the physical condition. And this is simply make a comparison of skin folds of eight sites, which I measured and compared by their positions. This kind of figure is very useful and also gives very strong impact to athletes or supporting staff to suggest or what they need to do. And whenever I do nutritional support activities to athletes, this is regardless of high school athletes to university athletes or perhaps professional athletes. Whenever I provide feedback reports to them, I give this kind of figure to the report and provide a comparison data. This may be the group of the same team. This may be the group of same positions. This may be the data from overseas. But those comparison figures gives them very visual impact, and this actually gives the motivation to improve their physique. And if I can utilize or assess their diet or training scheme, like how much, how fast they can run or how tall they can jump, this kind of fitness test results, I can provide those data together. Then if I have a chance to follow them up in, say, 3 months' time or 6 months' time, the change in these values have a very strong impact, and the effect to their motivation and their self-confidence, self-discipline are enormous. So this is how we can utilize anthropometry to athletes. And with regards to associations between anthropometry and physical fitness is because this may differ between group of sporting events. So you have to first examine what anthropometric variables associate with physical tests. But usually skin folds do associate with a number of different performance or fitness tests. So this is just one of the examples, but I think this was from high school athletes, but you can see that the skin folds do associate with vast majority of fitness tests. So by understanding the associations between performance and anthropometric variables, us examiners can provide feedback reports with confidence as well. And I have been talking about the understanding adiposity and also distribution patterns, but for some sporting events, it is also beneficial to understand proportion of athletes. Especially this is useful in talent identification and talent development because the children whose proportion is going to differ still changing, we can detect children who may perform well in future or adulthood. Those proportions includes the proportions within the limb, such as brachial index or crural index. Some indices also available to assess proportion of limbs relative to stature. Some proportion of the trunks like waist to hip ratios or ilioacromial index, which is the shoulder to hip width ratio. And other indices include BMI, Bragg's index or Comic index. Bragg's index is the chest circumference relative to stature, and the Comic index is the sitting height and stature ratio. And if you have sufficient time to conduct detailed anthropometry, then we can calculate phantom Z-score as well. And phantom Z-scores and somatotype, perhaps I can discuss briefly. So this is the some figures using phantom Z-scores. This is to adjust body size based on the phantom reference value, which I introduced to you first day of this lecture series. By adjusting everyone's body size based on the phantom reference value, we can compare everyone's anthropometric values in relation to the phantom score. And in this way, regardless of body size in reality, we can make a comparison, or we can make a relative comparisons, and it's easy to make the differences visible. For somatotype, on the other hand, this is to determine or quantifying physique based on the concept that human body is a mixture of 3 components. These components are known as endomorphy, mesomorphy, and ectomorphy. They are always exist in everyone's body, but the magnitude or the proportion of each component are different, which result in differences in physique between individuals. So that is the concept. So that means, as you can see from this diagram, although individuals have quite diverse differences in physiques or in their physiques, but on average, there are some distinct differences in somatotype between sporting events and also between genders. So by understanding these differences, we can determine what is the ideal physique we should look for each athlete, and we can provide guidance or supporting advices based on the goal to achieve this ideal somatotype. So this is one of the examples. Probably I might have showed this slide in the previous guest lecture earlier this year, but this is the somatotypes of professional rugby players, but the higher rank rugby players or teams have more mesomorphic somatotype. That means more muscular physique compared to the Croatia, which has more endomorphic somatotype. That means although they are all rugby players, national representative rugby players, but their body composition or content is different, and higher the rank, they are more muscular, and lower the rank, although they may have a comparable body mass, the component is more adipose tissues. So that's the difference. So I often use this concept in my supporting athletes. I always provide this kind of somatotypes to participants. Then this is one of the studies I have done to assess the somatotype of Japanese futsal players compared with other players in different countries. This is quite interesting, but compared to Spain or from Poland, my study samples showed pretty much the same somatotype. So although the absolute values may be different, perhaps players in Spain or Poland, I can presume they are much taller, and also they may be much heavier. But in terms of physique, proportion-wise, they have a similar physique, which means the Japanese players can be more confident, and they do not have to hesitate to compete against other players in different countries because their body size is small. They can be more confident and can be more aggressive, and whether they have a chance to win or not, maybe it's depending on their fitness level and their tactics as a team. And compared with end of the somatotype and performance, this is one of the classic studies that they showed that the endomorphy, which is a relative fatness, do associate with performance in, I think this is the gymnasts. the elite gymnasts. So again, if you have a chance to conduct all required anthropometric measurements to calculate somatotype, and this somatotype can be useful to assess the performance or fitness level for athletes. So this will be the last slide, and I'd like to summarize that anthropometry is a very useful technique in both health and sports sciences. And in health sciences, anthropometry can be utilized to monitor growth and also to screen health risks. In sports sciences, anthropometry can be utilized to determine ideal physique, including proportionality and body composition of athletes to optimize their performance. And there are still a number of potentials to utilize these anthropometric variables and indices that can be calculated from anthropometry to utilize in these health and sports sciences. And it's up to you. What I said at the beginning. It's up to you, individuals, how you would like to utilize them. But it is important to acknowledge that you have to have good knowledge and skills in order to conduct measurements appropriately and also to interpret the results correctly. So this actually concludes my 3 days series, lecture series. But just before I finish off, I'd like to provide some advertisement. This is the International Scientific Conference on Body Composition, which is scheduled to be held in 9th to 10th of November this year via online. And it is my privilege to be invited as a plenary speakers. And if you are interested to know more about body composition and anthropometry, you are very welcome to join this conference. And if you are interested, you can search through Google, or you can type the URL shown in this slide. So this truly concludes my 3 days lecture series. And thank you very much for attending my lectures. And I hope you enjoy and gained some new knowledge through these lectures. If you have any questions, please let me know. So I'm happy to answer as much as possible. So thank you very much for your attention.
All right, thank you, Professor Masa. It's really okay. I feel like it's quite heavy to receive, but it's really fun as well, because you show a lot of research results, and then it kind of opened my mind that, okay, if you use this anthropometry, it can be applied for this kind of case, or for example, especially for athletes. Okay, when I see the almost last slide, it's about the somatotype. So, for example, if this athlete, you found out that the proportionality is not suited with this certain type of sport that he or she already in, what will you suggest? I mean, you will suggest to change the you know, maybe reduce the weight or something, or changing the class of tournament or any else?
Well, that's a very good question. That it's from a supporting staff point of view, it is really a decision for athletes, I guess. But if athletes do not want to be converted to different sports, or understand that he or she may be disadvantaged due to these differences in proportion. But if he or she still wants to participate in this particular sports, then what we can do as a supporting staff is to think together how we can overcome this disadvantage. So this may be we have to consider tactics. We may have to consider about the way to present themselves, or we have to find some strengths apart from the proportions that may assist these athletes to give a better performance. So it's going to be some challenge, obviously, but because proportionality is not only the factor that influences performance, so it's not 100% affecting by proportions. So there are some ways to get through it. So but just I think athletes do require additional efforts to put themselves. So they have to push more, work hard, and have to overcome their disadvantage.
All right. Okay. Thank you for your answer. Maybe anyone from the attendants want to have deliver some question or some idea, you can don't be hesitant to mention in the chat room. Okay. And also, okay, Professor, I'm wondering, you know, in Japan, there is a famous sport, for example, like sumo. Like,
Yes.
well, I don't have it in Indonesia, so I'm like wondering, like, how will you suggest them as the anthropometrist? Like, okay, you're probably okay from the somatotype or all, I mean, like others anthropometric measurement, like mostly, I think mostly they have like very high body fat, isn't it? Right. All right. And probably it will impact their health in the future, because athletes' performance is just a short time in the life, right? So what will you suggest to the athlete or the coach, probably?
Well, actually, the many sumo wrestlers do have a high adiposity, but because they are athletes, mainly they accumulate their body fat as subcutaneously, so not as visceral, but subcutaneous fat. And many, not many, actually, the vast majority of sumo wrestlers, as I understand, they actually undergo weight loss practice after they retired. So what they have to do is they cut off their amount and frequency of meals, and then they do exercise to drop their fat level. So actually this is an important aspect, and that everyone actually do understand that part. So I don't think there is not much we need to say, because they know that they're obese anyway. So yeah, but they actually do practice weight loss management after they retired. So so once they retired, their body size do kind of diminishes quite a lot.
So, is there any, I mean, like any case of the athlete, for example, the sumo wrestlers that like have some health problem because of that? I mean, like changing the body weight, like from the big and then something like that.
Yes. Because I haven't had much research on small wrestlers by myself, so I cannot say definitely. I cannot say in explicit way, but many wrestlers, in terms of health, many wrestlers do suffer from their joint injuries due to their weight, and also due to from the bouts. So in this aspect, yes, they do carry some health problems after their retirements. But with regards to metabolic problems like diabetes and so forth, I am uncertain that if how many of them do possess those chronic health problems during and at the time of retirement.
All right. Okay. Thank you, Professor. Oh, we have a question here. Right. One. Okay. The first one is from Effie. Okay. Dear Prof. Masa, thank you for the great delivered topics. I have two questions related to your presentation. The first, as you mentioned previously, that Japan also high prevalence of low birth weight. Actually, I'm interested on associated factors or causes behind the low birth weight in Japan. Could you please give some explanations? Because in Indonesia, low birth weight commonly occurs in the low middle income family and related with inadequate nutrient intake of the mother. That is the first. And then the second, related to the athletes, physical for sumo athletes who have bigger body than others, do they have higher risk on metabolic disease due to their body weight? Is there specific treatment for them to maintain their health? Okay, that is almost the same like my question. Maybe you may answer.
Yes. Well, the second question is actually the same, basically same question to what you have asked. So, so basically, I am myself is not really sure if they do possess metabolic disease during or after their retirement. But for the first question, the one of the reasons of high low birth rates, infants' birth rate is the high body dissatisfaction among Japanese females. And so it's a distorted body image issue. So although Japanese females and nowadays men as well, but they look small, and many other countries said the Japanese girls are very small and cute, but many of them do think themselves as being plump and also still having a heavy weight. So they actually undergo weight loss management, weight loss practices, which is mainly due to energy restriction, not through exercise. or physical activity. So this actually results in a deficiency or insufficient intake of a number of energy and nutrients, and which is one of the concerns that is happening even from primary school children, primary school age. And if those females who possesses high body dissatisfaction and the continuing energy restriction from early age to the young adulthood, then those females who are now get married and are ready to having babies, they are at the chronic undernutrition state. So this is the one of the concerning factors that may result in development of or delivery of low birth weight infants in Japan at the moment. And also from the epigenetic perspectives, this may be affecting genetic methylation in infants' DNA that increases the possible risk for getting overweight and obese among those infants or low birth weight infants. So of course, there is some household with low socioeconomic status in Japan, but I think unlike Indonesia, the economic factor is not as much as higher risk factor compared to this distorted body image issue. That's my opinion.
All right, thank you. I think I also have some experience with my friend. She graduated from one university in Japan. So when she came back and she got pregnant, and then she mentioned like, I don't want to be like too big. So because in my experience, all people, I mean, like mostly female in Japan want to keep the body image, like body weight, like still skinny or very slim. So she said that she doesn't want to increase the pregnancy weight like too high. So I don't know. I mean, like that is very new for me. So I think like, is that common in Japan or? But I think it's related with the body image.
I think so. Yes.
Cultural. Yeah.
Yes, and also it's. I think it is increasing to take the leave for raising children, but not many. Still, many mothers go back to their work sites quite soon after the delivery. So maybe those things also influencing mothers' psychology, that they want to keep their physique similar to before get pregnant.
Understood. Okay, all right. The next question it's from Lucia. Why underweight infants increase risk of childhood obesity and non-communicable disease later in their life? I think it's also related with something underweight, something like that, right? Okay.
Yes. So thanks for Lucia. So I have been explaining about this question just now, but also if infant did not receive sufficient energy during during the mother's uterus, then there is a potential risk that the methylation of DNA may happen, which is actually provides infants property or a new ability to store energy more efficiently compared to those infants with no methylation in some DNA. So in this case, infants have a higher chance of survival with minimum energy given from mother. But once the infant was delivered, and then the society is now we can obtain more energy easily. So first of all, it's easy to get overeat, and also other reason is that the baby's parents or grandparents worries too much and try to give excessive amount of bottled milk, or perhaps stop breastfeeding too soon, giving weaning, which is high energy dense and maybe high protein content compared to breast milk, so that the baby is given too much energy and nutrition, which is actually accelerates baby to grow, but at the same time, the baby's adipocytes is easily undergo hyperplasia, which is increasing number of adipocytes cell number, which gives more space to store the excess energy as fat in adipocytes. So this increases more chance for those babies who born in low birth weight to gain more weight in childhood, especially those who experienced rapid growth. And then this can be carried out to adulthood obesity or adulthood overweight. So this obviously easily risk factor for metabolic syndromes and non-communicable diseases as a whole. So hope this makes sense to you. Yep.
Okay. All right. Thank you. I think it is quite clear and I mean, like the pathway how from the low birth weight baby and then develop to become the adulthood with non-communicable disease is really clear. And also as so many research related about the underweight baby or malnutrition baby and become the adulthood with the NCDs. You may look forward for that. If you still need some explanation, you can ask at the chat room now, or maybe you want to search again. Both is okay. But okay. For today is the anthropometry in the health and sports science. I'm thinking after this course, it gives me another idea. If I am planning to take care of some athletes, so this anthropometric knowledge, I think is very important to deliver to both the coach and the athlete. Don't you think so?
Yes.
Yes. But after they understand the anthropometric, it means I have to take care their diet to, for example, like to prevent them into some injuries later if, for example, the proportionality is not fit them, and I put I give suggestion to the coach. Yeah, just put it in this class. It's okay. It might give the athlete trouble with the injuries later, right? Am I understanding right? Okay. So yeah, I think this anthropometry is very important in sports science, especially if we preparing or dealing with some athletes' performance. Yeah.
Yes, and also if I can add, because like anthropometry is can be a very useful communication tool. So communication tool between different professions that involves in athletes. So like coach, physical fitness trainer, medical trainer, physiotherapists, because anthropometry involves anatomy and physiology, and so we can, this is a common language to all of us. And by understanding all these variables and what these variables indicates, we can make a good communication between support groups, support team, and then as a team we can provide kind of one good recommendations and training advice to athletes who we are supporting for. And this is another, this is one of example which I here I heard from my ex candidates of the Isaac course, which I introduced yesterday. She was obviously she's Japanese, and she cannot speak fluent English, but because nowadays many professional teams do invite coaches from overseas, from Australia or from the States or the England. And so the coaches do have their own experiences from their home countries. And of course, they have to have a good conversation or communication between coach and supporting staff, such as sports dietitians. But because she had anthropometric knowledge and skill, and especially she had this Isaac accreditation, this made much easier to obtain trust from coach, because the Isaac protocol is well known, and many countries do conduct athlete support based on Isaac protocol. So and many athletes from overseas, like from players from South America or from Europe, they have been experienced actual regular measurements of skin folds. So by knowing these techniques and skills, they can conversate with athletes and coaches more frequently, and easy to get good conversation. But if she hasn't had this good understanding on anthropometry or accreditation, she may encounter much difficulty communicating with athletes or explaining her thoughts or opinions to coach. So yeah, in this respect, anthropometry can be used not as a useful skills to assess athletes, but also as a common language between athletes and support staff.
All right. Okay. All right. Thank you. Now I found out another challenge for me to deal because I mean, like, okay, for the professional athlete, probably they already have their supporting team that really good. But for the beginner athletes, for example, the childhood, not childhood, the junior athletes, like, okay, I have to like make them understanding, and then how many times a year that you suggest for junior athlete to be measured? I mean, like in terms of anthropometrically or another index for like to maintain their performance, because I want my junior athletes still have the good performance until they senior, because that is like generation.
Yes. Well, it's depending on the schedule of the team, and also if the age of this junior team is like in puberty or still childhood. I think it depends, but because any physical trainings causes changes in muscle tissues or body composition, maybe after 3 months or so. So I think it is not really a point of measure every month or so. So I would suggest perhaps you can take a measurement every 3 months. So that's 4 times a year. But if it's difficult, if it is difficult, maybe 3 times a year is still okay. So it's and also you need to consider that there's always off season and on season. Yes, so you need to consider when you like to know their physique. So if you like to find out just before the training starts, so it's the end of off season, then measure again just before the season starts. So maybe 2 months or so later. Then during the season, you may measure maybe once, because depends on the aggressiveness. That time is the mid-season, maybe a good time to know rate of injuries or whether any problems in performance for certain players. And then you may measure at the end of season again, or maybe you can skip that and then go back to off season. So it can be flexible, but maybe not too much, not too soon to each other. So maybe 3 months apart may be a good indication.
Thank you. We have another question. I think this one is related with the body weight on the child. Okay, from Christy. Thank you, Professor, for the new lessons. And then the question is, if a child is underweight and happens to also have a deformed head, which one do we assess first? do we assess for the size of the body? Is that the weight per height ratio or the head deformity? Thank you, in fact.
Oh, okay. Usually, I think it depends on hospital, depending on the hospitals. But when the baby was born, they actually measures both head circumference and the birth weights on a spot. So I think that they will be measured at the same time. But if there is hospitals, if the hospital you are thinking of do not measure head circumference, then but measures birth weight, then you can simply add head circumference for the assessments of head deformity. So yeah, I wonder if this question came up because Indonesia do not measure head circumference.
I think we measure. Yeah, for the child under 2 years, usually we still measure the head circumference.
Then it should be measured both values, so shouldn't be much of problems. If you are thinking, if Christy is thinking about head deformities as the shape or the ratio between length and breadth, then that's something that the additional measurement that the medical staff need to do.
Right. I hope that's answered the Christy question. Okay. All right. Let me ask to the MC, Ms. Wulan, how many times do we have left for the post-test probably, or we still have time for question and answer? Maybe anyone have the question, another question? How many times left, Ms. Wulan?
I think if you want to stop the discussion time, it's okay. Because after this we have 10 minutes for the post-test sessions.
Oh, all right. Okay. If anyone doesn't have any other question, so maybe we can let Professor Masa to rest because we have a lot of questions, and you know, this is, I mean, like, I'm very grateful that we have these courses. I learned a lot, and I believe that everyone also learned a lot. So I think, yeah, maybe I will give the screen for Ms. Wulan to continue with the post-test. Thank you, Prof. Masa. Thank you.
Thank you.
All right, thank you so much, Professor Masa and Dr. Elmir, for the insightful talk and interesting discussion so far. Okay, here we've got lots of insight, of course, about how do the anthropometry application works, especially for health and sports sciences. All right, as I previously mentioned in the last 2 days, now we have a post-test session. So dear all participants, you may check your chat box Zoom to get the post-test link. Okay, here we go. And we have about 10 minutes to finish the post-test. And this post-test is one of the requirements for all participants to complete, so you may get the e-certificate. So please, everyone can finish and submit the post-test. And now the time is 20:44 Jakarta time, and we will finish it at 12. Sorry, now the time in here is 12:44 p.m. Jakarta time, and we will finish it at about 12:54 p.m. Okay, the post-test time starts from now.
Professor Masa, maybe I will contact you later related to some idea for the research.
Sure,
Yeah, all
sure.
right.
Please. Looking
Yes,
forward to it.
I have a lot of things that will come up with some good idea for research.
Yes, that's great.
All right. Thank you.
Thank you.
Okay, dear all participants, time for presentation is up. I hope you have already submitted the form. If not, you may continue 5 minutes more on your own. And don't forget to fill in the attendance form, which is sent by the host into the chat box room. Okay, before we close today's course, again, let's have a photo session together, everyone, because today is our last day of summer course. Okay, for all participants, please kindly to open your video camera. Okay, and prepare your beautiful smile, guys. Okay. All right, here are the faces of our participants. Okay, there are some participants from Japan and Malaysia also. Okay. Okay. Okay, as always, we're gonna have 3 times of documentation. Okay. Are you ready? Okay, let's start the photo session right now. For the first slide, 1, 2, 3. And the second slide, 1, 2, 3, smile. And for the last one, 1, 2, 3. Okay, thank you very much for our participants. Ladies and gentlemen, we have come to the end of our summer course. Once again, thank you so much, Professor Masa. We are so glad to have you here. We hope you're always healthy and have a good condition so we can meet again in the next occasion. And also big thanks to Dr. Emir for guiding us during the course. And of course, thank you very much for all participants for coming. And again, don't forget to fill in the attendance form to get the certificate. All right, that's all for Public Health Airlangga University Summer School 2021, Understanding Human Body Composition and its Assessment Technique. Assalamualaikum warahmatullahi wabarakatuh. Good morning, stay safe, stay healthy, and see you in the next course. Bye-bye. Thank you so much, Professor Masa.
Thank you.
Bye-bye.
Thank you.